Welcome to the Lengthening Techniques presentation. The purpose of this presentation is to provide the health and fitness professional with the knowledge and rationale for the use of static stretching as a muscle lengthening technique within a corrective exercise program. Following this presentation, the health and fitness professional will be able to describe the scientific rationale supporting the use of lengthening techniques in a comprehensive corrective exercise program, and properly apply static stretching to improve range of motion and inhibit overactive, tight structures as part of a comprehensive corrective exercise program. As reviewed in previous presentations, inhibitory techniques are utilized in the first phase of the corrective exercise continuum to decrease overactivity of neuromyofascial tissue and thus prepare the tissue for other corrective exercise techniques. The second phase in the corrective exercise continuum is to now lengthen those overactive or tight neuromyofascial tissues. Lengthening refers to the elongation of mechanically shortened muscle to increase range of motion of the joint. There are several stretching methods available to accomplish this. However, for the purpose of this presentation, we will focus on static stretching. Traditional theory of static stretching. Arguably, over the last half-century, static stretching has been the most common flexibility training technique used by health and fitness professionals. Static stretching is a flexibility technique used to increase the extensibility of muscle and connective tissue and thus range of motion at a joint. Though the exact mechanisms responsible for the efficacy of static stretching are not fully understood, it is believed that static stretching may produce both mechanical and neural adaptations that result in increased range of motion. In other words, not only will a static stretch mechanically lengthen shortened neuromyofascial tissues, but it may also produce an inhibitory response via the nervous system to decrease excitability, thus allowing the tissue to relax and increase range of motion. Furthermore, because lengthening techniques such as static stretching are used specifically to increase the length of tissue, they are only necessary for use on neuromyofascial structures that have been identified through an integrated assessment process as being in a shortened state. Stretching has been the subject of debate for several decades, leading researchers to continue to study the effects, duration, and methodologies behind stretching. The traditional thought is that regular stretching improves flexibility, which results in a decreased risk of injury and improved performance. Consequently, regular stretching is a recommended component of exercise programs, such as during a warm-up and/or cool-down. The proposed mechanism for the use of stretching as it relates to muscle injury risks is illustrated here. The compliance or flexibility of the musculotendinous unit affects the relative amount of energy absorbed by the muscle and tendon. In other words, high compliance or efficient flexibility results in a relatively low amount of energy absorbed by the muscle and a high amount of energy absorbed by the tendon. Conversely, low compliance or poor flexibility results in a relatively high amount of muscle energy absorption and low tendon energy absorption. Since high muscle energy absorption may result in increased force and trauma to muscle fibers, increasing musculotendinous flexibility through stretching may lead to decreased trauma to muscle fibers, with a decrease in injury risk being the potential result. And here we see an illustration describing the proposed mechanism for the use of stretching as it relates to performance. The stiffness of the musculotendinous unit influences the work required to move the limb. In other words, increased stiffness of the musculotendinous unit, or poor flexibility, may increase the amount of work required to produce movement and decrease available joint range of motion. Conversely, low stiffness, or efficient flexibility, may decrease the amount of work required to produce movement and increases available joint range of motion. Thus, decreasing muscle stiffness through stretching may decrease the work required to perform a particular activity and potentially increases overall performance. New research regarding static stretching. Conversely, recent research has also indicated that pre-stretching negatively impacts force production and athletic performance and may not influence injury risk. The proposed mechanism for how stretching can negatively affect force production is illustrated here. The general theory is that stretching can affect the structural and neurological components of muscle, such as increased GTO activity, decreased muscle spindle and motor neuron excitability, and decreased cross-bridge formation, which can lead to a muscle's inability to effectively generate force. Conflict between traditional theory and recent research on pre-exercise stretching has created confusion between professionals and the industry, with the common question being asked, should stretching be performed to improve performance and decrease the risk of injury? To answer this question, we will review what the evidence has shown on stretching's effect on improving range of motion, performance enhancement, and injury prevention. Range of motion, performance enhancement, and injury prevention. Starting with static stretching's effect on joint range of motion. Stretching exercises are primarily used to increase the available range of motion at a particular joint, specifically if the range of motion at that joint is limited by tight neuromyofascial tissues. For example, a supine hamstring stretch will elongate the hamstring musculature, improving hip flexion and knee extension range of motion. In fact, some literature reviews have found that stretching, both acutely and chronically, increases the range of motion at the target joint. The research that has investigated changes in athletic performance due to stretching protocols is less clear than the literature supporting changes in range of motion. However, reviews of the best available research suggest that acutely stretching may have a detrimental effect on muscular strength and power. This effect generally appears to last less than 10 minutes, but some studies have found that strength may be impaired up to 1 hour following the stretching protocol. Conversely, chronic, long-term stretching protocols have produced varied effects on athletic performance. In addition to an increased range of motion, many studies have demonstrated increases in vertical jump, muscular strength, power, and balance ability after a regular stretching program. Furthermore, because lengthening techniques are used specifically to increase the length of tissue, they are only necessary for use on neuromyofascial structures that have been identified through an integrated assessment process as being in a shortened state. Strengthening exercises and integrated dynamic movements will then be utilized to address lengthened tissues and improve overall neuromuscular efficiency, potentially enhancing force output and performance enhancement. Many coaches and athletes performing stretching as part of a routine warm-up prior to activity are prompted by the belief that stretching can prevent certain injuries. The current evidence suggests that acute pre-exercise stretching does not have a significant impact on injury risk. However, several researchers have shown that regular, long-term stretching can lead to a decreased incidence of injury, decreased cost of time lost from injury, and fewer severe muscle and tendon injuries. In some of these studies, injury rates were decreased by 18 to 43%. In all of the studies cited, there does not appear to be any negative consequences relative to injury risk when implementing a regular or acute pre-exercise stretching program. As indicated by the aforementioned review of research and literature surrounding flexibility, the following has been determined. First, there is moderate evidence to indicate that regular, chronic stretching improves range of motion, strength, performance, and decreases injury risk in healthy individuals without identified limitations in flexibility. And second, there is moderate evidence to indicate that acute pre-exercise stretching performed in isolation decreases strength and performance and does not affect injury risk in healthy individuals without identified limitations in flexibility. NASM position on static stretching. Based on this information, the implementation of a regular stretching program during a customized corrective exercise program may be the most effective in improving performance and decreasing the risk of injury. Thus, NASM strongly advocates the use of static stretching as part of an exercise program for the purpose of increasing range of motion in mechanically shortened neuromyofascial tissues. NASM also promotes the use of static stretching prior to activity or an athletic event as long as it is used in conjunction with dynamic warm-up exercises. This is especially true for clients who exhibit human movement system impairments or muscle imbalances. If a dynamic warm-up is performed prior to muscle imbalances being addressed via static stretching, then the individual may compensate when performing the dynamic warm-up exercises and thus increase stress to the human movement system. The use of stretching, like any other form of exercise, should be pursued with an understanding of any potential risks involved. Health and fitness professionals working with special populations and/or clients with neuromuscular disorders or joint replacements must be cautious before implementing a static stretching program. Care should be taken at all times that pain is not felt during the stretching protocol. Mild discomfort from the stretch may be experienced, but this should be explained by the clinician. In addition, health and fitness professionals should avoid static stretching to any muscle or muscle group that recently experienced a strain or tear, and any areas affected by acute rheumatoid arthritis and/or osteoporosis. Unless otherwise directed, static stretching may be performed daily, using anywhere from 1 to 4 repetitions per specific muscle group. A static stretch should be held for a duration of 20 to 30 seconds, or up to 60 seconds for individuals age 65 and older, as research has shown the longer duration to be more beneficial in the elderly population. After static stretching, strengthening exercises and integrated dynamic movement will then be utilized to ensure the nervous system's ability to control this new range of motion, improving overall movement quality. Specific isolated and integrated strengthening techniques will be covered in later presentations. Summary. In summary, stretching is one of the most commonly used modalities by health and fitness professionals, yet it is still widely misused and misunderstood. As with all components of the corrective exercise continuum, proper application of stretching depends upon the needs of the client and the goals of the fitness program. Stretching should be used to correct faulty movement patterns found during the functional movement assessment, specifically to lengthen shortened neuromyofascial tissues, such as the adductor complex when a client's knees cave in during the overhead squat assessment. Stretching should not be used without conducting a movement assessment first. Please refer to the exercise video library for examples of static stretching techniques for different muscle groups.